Welcome to the show. I'm excited to be hosting two amazing individuals who are doing an amazing work in global health and healthcare sector, Dr. Beatrice and Mr. Eric. I'll let them introduce themselves because my introduction would not do justice to them. So starting with Dr. Beatrice, please tell us who you are and what you do.
Thank you so much. Thanks for having me. My name is Beatrice Wiafe Addai. I'm a consultant breast surgeon. I'm the president and founder of Breast Care International and BCI America. I'm the chief executive officer of the Peace and Love Hospitals. They are both based in Ghana. I'm also the chairperson of the Ghana Non-Communicable Disease Alliance. I'm a former chairperson of the Ghana Cancer Board. I used to serve on the ethics committee of AYAC. AYAC is the International Agency for Research on Cancers, which is the WHO wing on cancers. I also happen to serve on some boards, privileged to be a member of several boards. And I'm a mother, a wife, a mother of 5, 4 daughters, and a wife and a grandmother. Just became the youngest grandmother just last Tuesday. So I'm a proud grandmother and an advocate, a breast cancer advocate. Started this as a fight against breast cancer control, but used the breast cancer platform to create awareness about other cancers like cervical cancer and prostate cancer. I think that's a little about me. Thank you.
There is no way I would have done justice to that. You're doing amazing work, and congratulations on being a grandmother. But we'll get more into what you do. But first, Eric.
Yeah, so I'm Eric Broyles. I'm the CEO and founder of NanoCan Therapeutics Corporation. We are a biotechnology company that is getting ready to go into in-human clinical trials in the United States for prostate cancer. My background, I'm actually trained as an attorney. I was a corporate lawyer for 10 years and then decided to switch to become an entrepreneur and started investing in healthcare companies about 12 years ago. And through having some successes in other parts of the healthcare industry, I ended up meeting Professor Will Inwa, who at the time was a professor at Harvard's medical school, and he is obviously the founder of the Global Health Catalyst. And through my relationship with him and introduction to him, we have collaborated with my company, getting the global rights to an innovative technology that he's invented to work on cancer. So my interest in cancer stems from a personal story, as many people's interest is. And my father was diagnosed with lung cancer my 3rd year out of law school. And I just remember meeting with his doctors and having them say the words, "There's nothing we can do." And so at NanoCan, our mission is literally to help eradicate the words from medical cancer diagnosis that there's nothing we can do. And we think that Professor Inwa has come up with a very innovative way to give almost any cancer patient a fighting chance, no matter if it's metastatic spread or not. His innovation will likely give their bodies a chance to fight off cancer, no matter what stage they're diagnosed. So that's how I ended up working with with this project. I'm not a grandfather. I better not be, or my daughter has some explaining to do. So, but I'm the father of a 22-year-old daughter. I'm a brother. I have 4 siblings that I'm all very close to, large family, and we're all very close knit. I live in the Washington, D.C. area. My company is headquartered, though, in New Jersey. And I'm focused on this project, and I have some other companies operating in the healthcare space doing some pretty innovative things as well. But my focus has been on NanoCan and hoping to bring about a meaningful treatment option for cancer patients.
Fantastic. I mean, thank you so much for the work that you are doing. It's even more meaningful for me today. I lost a couple of days ago, I lost a friend here to lung cancer. It's just heartbreaking to see somebody you care about, and that there's research being done, but there's nothing that can be done to help to keep them alive. But with that said, you are both you both came into this work through different paths. Dr. Beatrice, you're a trained physician, and Eric just came from being a lawyer to investing into healthcare industry. So what impacted your decisions to take the paths that you took, and how has that evolved over the years, and how does it fit into the Global Health Catalyst? Starting with Dr. Beatrice.
Thank you. Starting from the beginning, I happen to be the 6th born of my parents, the first girl, and so among 11 siblings. That time, the girl child education was not in existence. So I had to fight to get myself educated. My brothers were going to the very high schools, but my father thought it wasn't necessary for a girl to go to school. So at a point, my teachers had to even come and beg my father to take me to the secondary school. That's the senior high school. So eventually, when I finished, I got a scholarship to enter the medical school. After medical school, I realized that I was the only female in the surgical department, and my interest was in surgery. And being the only female, a lot of women were comfortable to come to me. And that's when I realized that pretty much everyone who was coming with breast cancer was coming to die. They were just coming with very late stage disease. So I decided to specialize into breast cancer management, and finished as the first Ghanaian female general surgeon. Happy to say that after me, we have quite a number of ladies in the surgical field. So it's actually opened my eyes, and I got the shock of it when a 41-year-old woman was brought into my consulting room on the stretcher because she couldn't walk. She had bone mets, she had lung mets, so she was very, in severe pain and dyspnea, struggling to get some air to breathe. And then I realized that she had a very big breast. So the tumor was just piercing through the skin. And with anguish in her eyes and looking straight into my eyes and telling me that, "Doctor, I don't want to die." So I asked, "Why did you stay for so long?" And she told me, "Doctor, I didn't know. I didn't know that painless lump that I appeared some time ago was going to end me like this." And that sent a message to me that these women are coming late, not because they don't want to be treated, but because they don't know. And those days, you asked every woman, and they think a lump in the breast meant an abscess. It meant a boil. So they should go to the traditionalist to get some herbs to apply to it, and which will allow it to burst. So that evening, I went to a respectable woman in town. She's now a member of our board of directors. She owns a restaurant, Jofel restaurant. So I went to her and I told her, I want to go to the church to go and educate the women and to create awareness about breast cancer. So she said, okay, I can take you to my church. And so on Sunday, I followed her to a church. I educated them. They gave me a platform for some few minutes. I educated them, asked them to ask questions, and they were very simple, fundamental questions that they asked. But it's actually also opened the can of worms that there are a lot of things that we are not doing. There are a lot of things that as healthcare professionals, we need to do because our people had little knowledge about a disease that is so common like breast cancer. I'm talking about 23 years ago. And so after the church service, we planned to go to the radio station where a friend of hers was also hosting a radio program in the night. So we went and she also dedicated the time for breast cancer awareness creation. So I spoke on the radio. She opened the phone lines. People asked similar questions that they asked in the church. So it actually showed that it's an important step I was taking. There wasn't any model for me to copy or emulate. There was nothing like that happening. So I just had to sit and read about it. I found Susan G. Komen in the US, who had started creating awareness for some years. And so I started learning from them what they've been doing. And that actually kept me moving. Along the line, I realized that educating them alone wasn't enough because some people will come later, maybe 6 months later, 1 year later, and they will tell you that, oh, you came to my church, I was there, but I felt shy. I didn't know what to do. And so I decided to start training some nurses. I sold the idea to some nurses who also bought into it. And I decided to train them and to encourage them to go with me on outreach programs. And so started to clinically examine these women, teach them how to do their own breast self-examination, and clinically examine them. We don't have screening mammography. We still don't have it. So what we can do is to train and retrain our nurses the ways they can examine our women correctly and refer them for diagnostic mammography, those who have suspicious lesions in their breasts. So that's how it started. And thank God it has grown. And now we have people who also go around to educate people. Some organizations send nurses for us to train them to also go out there to educate and examine people. It has caught on in the country, and especially in October, a lot of organizations spring up. I call them mushroom organizations They are only active in October. So after October, they all go to sleep. But it's okay. It means that a lot of people are getting the information in October. We are encouraging them to continue after October because breast cancer doesn't strike only in October. So we hope that we will be able to train more and more nurses. We've trained quite a number, but we need to continue with the training so that more and more women will be educated and know when to report to the hospitals, because our people are dying because of late stage disease. If they will come early, then we could offer the treatment for them. At least what we have, we can use to help them to survive the disease. We are able to do breast conserving surgery because women do not like mastectomy. So, but we tell them, if you don't want us to do mastectomy, come early so we can do breast conserving and follow up with the necessary treatment. I think I'll hold on here.
Yeah, absolutely. Thank you so much. There's one part you didn't quite get into, but we can come back to that. And that's how you got involved with the Global Health Catalyst. But Eric?
Oh, let me just add that. Okay. Because you didn't ask that as part of the question, I thought we will come back to it. Yeah. So we've been doing our things. In somewhere like in 2017, I was elected as the president of AOTIC. AOTIC is the Africa Organization for Research and Training in Cancers. So in 2019, I got invited to Harvard by Professor Wolingwa to come and pick an award, the Global African Champion for Cancers in Africa. You know, I was surprised that I've heard about Professor Ngwa, but I haven't met him before. So how did he find me? Why? Is it not some prank or something? So I, did my investigations and realized, no, it's legitimate. And so I was honored to travel to Harvard to pick the award and to learn about the Global Health Catalyst Summit. I was part of I chaired some of the sessions, I made some presentations, and fell in love with Global Health Catalyst group. And now I'm a proud family member of the Global Health Catalysts, and that was the time we started the Lancet Commission's report. So I was elected as one of the 3 lead commissioners, and we started writing about oncology in sub-Saharan Africa, and got to know that there's so much that needs to be done. And I'm so grateful that I met Professor Wolingwa, who later on introduced me to such incredible people like Eric, who is a brother from different mothers, and became part and parcel of this great organization. And we were honored to host the premier launch of the report, of the Lancet Oncology report for Sub-Saharan Africa. Breast Care International launched it officially in Ghana, to open the gate for other countries to launch it as well. So that is how I came into that great family, and I'm happy I did. Thank you.
No, thank you so much. Eric?
Yeah, so I got involved with the Global Health Catalyst Summit through Professor Ngwa, who I'd met maybe 4 years ago in the context of discussing forming a company that would license from Harvard University his patented technology that works in the immunotherapy space of cancer. And so part of his commitment that he got from me, which was in alignment, was that we don't forget about Africa, right? So that's technology. You can commercialize it in America, do whatever you want, but don't forget about underserved communities, particularly in Africa. And that was a commitment I made to him 4 years ago. And so my involvement in the Global Health Catalyst Summit is my keeping my word, but also a desire of my heart. Professor Inwa knows that I've been doing other investment work in Africa outside of healthcare and cancer. And so it wasn't a stretch for him to get me to commit to help in this regard as well. So that's my involvement. It's a great network of really concerned healthcare professionals around the world who are committed to transferring knowledge, expertise, and technologies to help improve the lives of Africans in Africa.
And maybe a follow-up question to what you just said. You came from a different background, which is law and then investment. What are some of the things that have opened your eyes through the Global Health Catalyst as somebody who is not necessarily a doctor, but who does, who works in the healthcare professional or as an investor in some technology that people like Dr. Beatrice need for the work that they do?
Yeah, I mean, for me, I look at the world a little bit. I take a step back out of categories of being a lawyer or a healthcare professional. I kind of go up to the next level and look at, okay, there's a problem, and how do you solve a problem, right? And so having a brain that knows how to think through difficult problems and having a way of thinking to solve big problems is what I sort of focus on as being most important. I think it's interesting to note that it was actually a lawyer, a recovering lawyer like myself in the early 1800s who actually developed what is now cell theory of biology, the way, and it was German lawyer Matthias Schleiden in the 1800s who actually came up with cell theory and why you have the study of biology in the way that you do. He came up with the tenets of this theory after he stopped practicing law. So that's a model for me that somebody who brings sort of fresh perspectives to problems, who has the ability to think, can actually have a very disruptive impact. And I hope that I can follow in recovering attorney Schleiden's footsteps and have an equally big impact in cancer, extending his root foundation of cell theory, which is he got from his work actually initially as a botanist after being a lawyer. And so for me, as I started obviously thinking about healthcare when my father was diagnosed with cancer, and so it just made me do a deep dive into the human body, into cancer, and trying to figure out ways to save my dad's life. So I hired consultants, I talked to PhDs, I did everything that I thought that I could. But then that kind of opened my eyes up to like the human immune system and what was needed. And that was in 1998. So, fast forward sort of 10, 11 years, I started making investments in companies that focus really in sort of this area of delivery technologies that allows the body to maximize I'll tell you, my first investment was in a patch company, a transdermal patch to deliver vitamins through the skin, to make the vitamins more bioavailable to the human body. Because when you take them orally, you ingest orally, you may not get the full sort of weight of the actual vitamin versus going through the skin. And so made an investment in a company developing some innovative technology around that, and developed and has products on the market in that space. But in doing that work, I just came to learn and appreciate the importance of the human immune system. And if you think about the biggest breakthrough in cancer care in the last generation, it's immunotherapy, right? Getting, revving up the immune system. And so I've made a series of strategic investments around this notion of how do you put your immune system, the human immune system, in its best fighting position. And so that's sort of the thesis of my investment and the thesis of the product that we have licensed from Harvard, which allows the delivery of immunotherapy in a way that enables the body to fight cancer more effectively and in a different way than it's currently being fought, which is maybe killing the cancer cells with external items versus killing some cancer cells so that you can give a master class to the body's immune system on how to identify cancer and then go out and wipe out metastatic spread in a patient's body, which is what our technology does.
And, it's exciting hearing you talk about this technology, because I first got to know about you when Dr. Ngwa was talking about these tiny drones. And, and he was, the way he would elaborate it was so amazing using. And so I will want to get you back to just at some point to talk about that technology on its own, probably outside of this conversation, so that we don't prolong this one. But yeah, my next question is going to be you're into investment of the technology that is used, and Dr. Beatrice is on the front line, as a doctor. So as the two of you, how do you perceive this platform called the Global Health Catalyst, and what do you want? What has it given you in your different roles, and what do you want to see going forward as the vision for the Global Health Catalyst Summit?
Yeah, well, solving any problem requires a team, right? People bringing different areas of expertise to bear on that problem. And so the Global Health Catalyst has brought together academic, research scientists, medical doctors, oncologists, people from different disciplines, finance people, government folks. It's going to take a collective effort on the challenging problems we have. So we all bring different skill sets and abilities to this fight. And for me, it's about running a company that is going to provide doctors and treatment centers with a very effective drug therapy and delivery system, drone delivery system that can help their patients fight cancer, no matter what stage the cancer is in.
Dr. Beatrice?
Yes. For me, the Global Health Catalyst Summit has done too much, already, because it's opened a lot of ideas, a lot of opportunities to even meet the caliber of people who are in the, in the kitchen, preparing the food for everyone to eat. For the kind of people who are entrepreneurs, philanthropists, people who are passionate in whatever they are doing. And, a little example, when we launched the Lancet Commission's report in Ghana, we visited my hospital in Kumasi, and we met the lady who at the age of 13, a girl actually, at the age of 13 was diagnosed with breast cancer. So we had to do double mastectomy. And she's 16 years. She was 16 last year. So the moment Eric saw this lady, he just asked for where he can donate to help in plastic surgery for the lady, and immediately contributed $6,000 towards this lady. I mean, you need to sometimes look around for months, for years, to get people who be ready to even contribute something little towards a person in need. And we find people who are ready. Since June, we've been having meetings. We used to have them every week, every Sunday. We were meeting as the group who are ready to give something back to Africa. And we moved from once a week to 2 weeks. Every 2 weeks, we meet. And imagine what that means. People who have their own businesses, they have their own works to do, they are traveling here and there, and yet they are interested to do something to give back. During the summit in Johns Hopkins, we promised, and my daughter, Dr. Lauricia, who is a gynecologist, actually made that commitment and made us all commit to doing something about the challenges that we are finding in Africa, in sub-Saharan Africa, so that the next summit, we will have something to report on. So we decided to have a one-stop comprehensive cancer center of excellence in Ghana. Yes. So the Peace and Love Hospital had acquired a 52-acre plot of land that we have donated to this project, that this idea, this dream can be materialized. We've been creating awareness. We've been talking about the cancers. That is the first step. But after that, we have to do something. So to do something is what we've been working towards. And I'm so happy that the summit in May, the first day, we are going to have a Ghana evening where we are going to showcase Ghana. We are going to let people know that this is the place that we are going to put down the Comprehensive Cancer Center of Excellence, where we are going to do preventive measures, we are going to educate, we are going to train, we are going to treat, we're going to have palliative care, we are going to do research, and we are going to train doctors and nurses and scientists in sub-Saharan Africa. The same education that is being given in Johns Hopkins, in UPenn, in Harvard. We signed the memorandum of understanding between Peace and Love Hospital, Breast Care International, and the Kwame Nkrumah University of Science and Technology. We are having 7 lecturers coming from the university to UPenn for the summit, including the Vice Chancellor herself. So they are going to help us in signing that document, the contract, the MOU with UPenn. And so the summit this year is going to help us to gather the funding that we need. We need to go out there and ask people to contribute. Before we even go, let me thank Eric's pastor, Eric's church, for agreeing to donate something to Breast Care International. And they are going to help us to cater for those who are so vulnerable and do not have money to come to the hospital, and also to help us to educate those in the communities, those in the villages, because they are poor, and to travel to the cities is sometimes a huge challenge. So I want to thank Eric and his church and people who are ready to help us materialize this dream of ours. I'm very sure that if we are able to start this, our children, our grandchildren will be able to continue and finish it up for Africa to benefit from the brain drain that we've always been talking about, that we will now be having a brain gain, and according to Professor Ngwa, brain circulation, which is very important. Yeah. So I want to thank the team that has been working in the Global Health Catalyst Summit, the team that is cooking this meal for everyone to eat later on, and to say that I want God to bless them, to continue to bless them, so they will also continue to be passionate and contribute their quota towards humanity.
Yeah, thank you. No, thank you so much, Dr. Beatrice. And I will get back to you with a question. You can think about it as after Eric. And the question I'll have for you as a follow-up is, given that we're trying to address cancer treatments and cancer challenges within sub-Saharan Africa, and at least you're having what I would think is like an upper hand or the first step in the region. Do you have a vision for rolling out these into the rest of Africa? I'm from East Africa, so I have to selfishly ask, but I'll get back to you on that. But in the meantime, Eric, as somebody who invests in technology to help with these therapies, what advice or what can you tell other investors who are out there, about joining forces with programs like the Global Health, so that we can have more investments into these programs, because they do require technology, they do require investors, and they do require, partners. What is something you can tell our potential investors?
Yeah, I mean, look, Africa is it's a large continent. It will be, I believe, in 30 or 40 years, may be the most populous continent in the next, I know certainly within the next 50 years, its population. And so it's a very large market, right? And has a lot of opportunities. So that's what I would tell investors. It's a large market, developing market with a lot of opportunities. Each, investor or company is going to have to figure out where their product can sort of fit into the ecosystem. I know for us, the fit for us is that our treatment is a 1 to 2 treatment regimen, right? So it doesn't require somebody to potentially have to have a burdensome travel 10, 20, 30 times to get treatment. It's likely 2 times and then surveillance after that, after the treatment. And so it's a market that is a good fit for our type of technology, which doesn't require, again, the patient come back 30, 40 times, where you probably would not be able to get your product into the patient after a certain number of treatments. But large market, a lot of opportunities, a lot of growth opportunities. And I think for those reasons, it's worth investors taking a look.
All right. Thank you, Eric. Back to you, Dr. Beatrice.
Yes. So let me start saying that according to the Lancet report, and for those who haven't even read the reports, I will advise them to have a look. There's so much information in that report. The Lancet Oncology, the Lancet Commission's report on Sub-Saharan Africa. According to the report, by the year 2030, if nothing is done, about 1 million Africans are going to die from cancer. We are in 2023, so 2030 is just across the corner. And what are we doing? We are talking about the whole of Sub-Saharan Africa, even though the center is going to be in Ghana. We know of a lot of Africans who travel to Europe, to America, to Asia, to South America for cancer treatment. But what is the percentage? Majority of the patients cannot travel to these countries. And so it's a drain on the people. It's not only a public health concern, it's an economic issue. It's a developmental issue. And so if we are able to have this center in Ghana, it's going to train doctors, scientists from all over Africa. And it's also going to cater for cancer patients from all of Africa, not only Sub-Sahara, West Africa. So East Africa, you are covered. So we want to encourage industry, governments, philanthropists, individuals who can help to come on board, because a lot of our people are dying needlessly. This assignment that we've taken upon ourselves cannot be executed by Global Health Catalyst Summit alone. We need collaborators. We need financiers. We need our governments to even be part of it, because cancer doesn't discriminate. Everyone can be diagnosed. Yourself, your family members, your wife, your husband, your children. So we should see it as a personal. I lost my mother to cancer of the pancreas. Nothing could be done, So cancer has touched almost every family. And so let's not see it as something for the doctors to do. We want African countries to prioritize cancers. Unfortunately, our minds are always on the communicable diseases. And, because those are things that happen and can take away people quickly. But a lot of people are dying needlessly, quietly from the non-communicable diseases. And here I want to highlight on the cancers, which are killing actually a lot of people because of the slow nature. A lot of people's minds are not on it until it's, it comes so close to their knees. And that is why we want our countries, to our governments, to prioritize the cancers so we can diagnose early stage disease, use the research that has been done with Prof. Ngwa, Nanokan, Eric, who are ready to send their findings to Africa for us to also, benefit from it. We have to make sure that our people benefit from the state-of-the-art equipments, the cutting-edge research findings, so that our people will not only cry about brain drain, but also benefit from the brain gain and the brain circulation. Train our doctors and our scientists so that the same treatment that is being given in Harvard, Johns Hopkins, in the UPenn, the University of Pittsburgh, will be given in Ghana as well, no matter where the patient is living. I mean, where the patient lives should not determine whether she should die or survive cancers. We should make sure that everybody survives the disease as much as possible. And I also think that health inequality, health inequities are the major injustices that we have. If we would think about this and think about the injustice to humanity, health inequality is one of it. Thank you.
No, absolutely. I am so humbled to have the both of you here, just sharing your experiences, your observations, your contributions with us. Thank you on behalf of everyone out there who is benefiting from your services. And before we go, I just have maybe one last question. Just for this session, you'll come back some other time. But what is the one thing you're looking forward to at this year's summit at Johns Hopkins? I mean at UPenn. Starting with Dr. Beatrice and then Dr. Eric.
Yeah, it looks as if I'm expecting a lot. I'm expecting a lot of collaborations, a lot of contacts, meeting a lot of people, like-minded people, and also to bring on board this project that we are trying to do in Ghana, the Comprehensive Cancer Center of Excellence, and to think of how we can get the funding to do this job. The signing of the documents between Breast Care International, the Peace and Love Hospitals, and UPenn is going to be the icing on the cake. And so let me use this opportunity, your medium, to invite everyone who is ready to contribute his or her quota. No contribution, no amount is too small. We are open for various contributions from industry, from private sector, from individuals, philanthropists, to come on board and to help us to hit the ground, running. Thank you.
Thank you. Eric?
Yeah, for me, I'm looking for two things, action and results. So I want the group to stay focused on, taking actions and delivering concrete results. So it's really that simple and straightforward for me. These conferences are great, but if we can't point to anything that we've actually accomplished the year before, it's like just having a party. And there are other ways to do parties. So I want to see the group take action. I think from last year, we've taken concrete actions to help Beatrice to establish her oncology center of excellence, and hopefully we'll have in pushing that forward. And then, hopefully a year from now, the result will be a groundbreaking on construction for the center. That's right. So that's the type of concrete outcome I'm looking for. But that's all I look for when I go to participate in something like this.
Sounds like a businessman. But yeah, that's awesome. No, again, thank you both of you for being my guests on this show and for everything.
For having us.
Thank you. It's great spending time with you.
Oh, yeah. Oh, and I look forward to seeing you all in May. And to our viewers, thank you for watching. Till next time.